was World Heritage City, and that's where I'm living. And as a patient ambassador and a moderator of Indian Cancer Society, the Libraj, I am super excited and thrilled to welcome Dr. Jagdish Kotari. Before I introduce him, I want to mention one thing profoundly. That is the one along with his colleague Dr. Kaltupadir given me life to zero before 28 years. So I am having a connection and everything with Dr. Jagdish Bhai and Dr. Kaltupadir for more than 10,000 days. So, sir, saluting all your dedication, everything you have done, and we welcome you on board, especially to talk about robotic surgery and pertaining to GI and other segments. And friends, Dr. Kotari has performed more than 500 robotic surgeries so far, and at SCG Cancer Cancer Center, more than 2,500 cancer surgeries been performed through robot. Sir, over to you now, and the stage is all yours. And thank you once again for your valuable time and sharing your knowledge, experience, and expertise with everyone present today. Today we have a student from fact, management segment as well. Over to you, sir. Thank you.
Uh, Thank you, Shrenik Bhai, for all these kind words. Uh, First of all, I thank Indian Cancer Society for giving me this opportunity to reach out to the people across the country. And, Friday with Shrenik, I'm thrilled to be a part of this. As Shrenik Bhai mentioned about it, that we have association which goes long so many years, and Shrenik Bhai is like a family to all of us at HCG Asta Cancer Center, where we are working presently. Uh, Based on the topic which I have selected and had a discussion with Shrenik Bhai, that I would like to give a brief idea about my specialty of treating gastrointestinal cancers. And I'm very much excited and passionate that I have been doing robotic surgeries for my GI cancer patients for last 9 years. And just as a prelude, I would say that if somebody asked me that, Doctor, why are you doing this surgery robotically, which you have done for almost more than 20 years in a conventional open surgery method? The only reason, I have a very simple answer to that, that I'm very happy the way patients are recovering. This is the only driving force for me in continuing this. And I'll try and put forward my case, how I am justifying the sentence which I made. So, is my presentation visible?
Yes, sir. Very well. Very well.
Okay. So, this is the place which has been recently commissioned about 8 months back. This is a 200-bed uh, comprehensive cancer center, and known as HCG Asta Cancer Center, wherein we have all the modern facilities to treat cancer patient under one roof. We believe that by doing this, there is a significant efficiency in management of the cancer patients when they are treated under uh, comprehensive cancer center. And we have excellent technology as well as team, the latest radiation on machines, chemotherapy facilities, PET scan, in-house radiology, in-house pathology. And besides that, On the top of that, I would say that, we have 12 modern operation theaters with all the facility to carry out surgeries for any kind of cancers, and which the surgery would be carried out in this kind of operation theaters on a baby which could be just couple of days to a patient who would be more than 90 years of age, and any kind of cancer affecting any organ from brain to the toe. I would say, this is how we have established this cancer center and functioning here in this cancer center. uh, the idea of talking about this precision power and healing, it's combination of the technology and ultimately resulting in a better healing. And this is the platform. Once again, I would say that Indian Cancer Society and Shrenik by together, I am really privileged to talk on this. This is our team of doctors, my team of cancer surgeons. We are more than 25 cancer surgeons practicing at this place. And as I mentioned, we carry out surgeries for any kind of cancers, may it be a GI cancers, head and neck cancers, breast cancer, gynec cancer, urology cancers, skin cancers, bone and soft tissue cancers. All kind of cancers are treated by a team of doctors for better outcome. When we come to the specific topic of the GI cancers, this is one of the leading causes of cancers in India, and in that, colorectal cancer is more than 50%. Colorectal cancer used to be
Sir,
considered, yes.
uh, I mean, my English and the Hindi mix, white culture, please, Hindi and English mix.
Say that again, sorry.
I said, try to speak in a mixed language, Hindi and English both.
Oh, okay. Sure, sure, I will. Uh, so, आंत का कैंसर, बड़ी आंत का कैंसर एंड गुदामार्ग कोलोरेक्टल कैंसर जो हम बोलते हैं, दिस इज द commonest cancer when I talk about GI cancer, from the food pipe to the rectum, including liver, pancreas, gallbladder. So colorectal cancer common है. Colorectal cancer पहले माना जाता था कि this is a Western world cancer, but we have been catching up with the rest of the world. और जहां पर हमने बाकी सब एरियाज में we have been competing with the rest of the world. Unfortunately, the colorectal cancer is also following us. So the incidence of colorectal cancer has started rising in our country as well. For any cancer, we would always say that awareness चाहिए हमें प्रिवेंशन के लिए, अर्ली डिटेक्शन के लिए एंड अर्ली एक्शन के लिए. Then only the outcome can be very good for cancer, not only for survival, it is also for the quality of life. What we nowadays talk about more कि organ preservation कर सकते हैं हम. जो भी कैंसर की बात करें, इंटेस्टिन का कैंसर है तो हमें पूरा इंटेस्टिन निकाल देना पड़े, वो नहीं है. आज हम गुदामार्ग के कैंसर में काफी आगे बढ़ चुके हैं, और जहां पर रेक्टम का कैंसर बोलते हैं, वहां पर पहले जब मैं स्टडी करता था तो रेक्टम के कैंसर के बाद, सर्जरी के बाद, मोस्ट ऑफ द पेशेंट्स दे वेर अल्टीमेटली एंड अप विथ कोलोस्टॉमी. दे हैव टू the intestine, the end of the intestine would be kept outside onto the abdominal wall, or patient has to wear एक बैग, एक पाउच पहन के उन्हें रेस्ट ऑफ द लाइफ जीना पड़ता था. अभी ये इंसिडेंट्स काफी कम हो गए हैं, क्योंकि अर्ली डिटेक्शन होता है तो हम लोग रेक्टम को बचा सकते हैं, और हम टेक्नोलॉजी के यूज से रेक्टम को जोड़ने का भी काफी पॉसिबल हो गया है. सो दिस इज हाउ द अर्ली एक्शन is very important. Now, why surgery? When we talk about GI cancer, why surgery? Because the whole point is that, so in so far, for most of the GI cancer, the surgery has remained the cornerstones for many years. Things are changing. लेस म्यूटिलेटिंग सर्जरी, पूरा पूरा ऑर्गन हमें नहीं निकालना होता है। और जब अर्ली स्टेज में हमारे पास पेशेंट्स आते हैं तो हम ऑर्गन भी बचा सकते हैं। जब हम कन्वेंशनल सर्जरीज करते थे, बहुत सिंपल लैंग्वेज में चीरफाड़ करते, जो हम लेप्रोटॉमी करके पूरा पेट खोल के ऑपरेशन करते थे। और हमारी एब्डोमेन की सर्जरी की बात करें, जीआई सर्जरी की बात करें, तो दे आर ऑल वेरी मेजर ऑपरेशंस, और हमें पेट खुला रखना पड़ता है 4 आवर्स, 6 आवर, 8 आवर्स, 12 आवर्स। तो उसके साथ there were issues relating to the outcome of this kind of surgeries, and that is where the laparoscopy surgery started, what we call it as a minimally invasive surgery. Laparoscopy surgery started before 30 years, and for last 20 years now, robotic surgery. Laparoscopic surgery for cancer, there were lot of limitations, तो वो जो limitations थे ओवरकम करने के लिए रोबोटिक सर्जरी हैज बिकम नाउ वेरी कॉमन। नाउ ये क्या है, रोबोट क्या है? तो उसमें बहुत बड़ा एडवांटेज हमें ये मिलता है कि उसमें 3D विजन मिलता है। एंड व्हाट वी से इसके 3D विजन हमें जो मिलता है, 10x मैग्निफिकेशन होता है। और हमारे पास जो इंस्ट्रूमेंट्स होते हैं उसमें रिस्टेड कंट्रोल, मैं आगे बताऊंगा वीडियो। तो पूरी रिस्ट की मूवमेंट जैसे होती है उससे भी ज्यादा मूवमेंट हम कर सकते हैं इनसाइड द एब्डोमेन। एंड द एक्सपीरियंस हमें जो मिलता है, इट इज लाइक एन इमर्सिव एक्सपीरियंस। हम मरीज के एब्डोमेन में बैठ के सर्जरी करते हैं, ऐसा हमें लगता है, जिसमें प्रिसीजन काफी अच्छा रहता है। और द आउटकम इज डेफिनेटली बिकम मच बेटर, मच सेफर, एक्यूरेसी ऑल्सो हैज इंक्रीज। और जो जगह पर हम लोग ओपन सर्जरीज में नहीं पहुंच पाते थे, ये रोबोट के टाइनी इंस्ट्रूमेंट्स एंड रिस्टेड मूवमेंट से हम लोग काफी एरियाज ऑफ एब्डोमेन में हम लोग पहुंच सकते हैं। नाउ हाउ डज इट लुक लाइक? तो हमारे पास जो रोबोट है, वी आर डूइंग नाउ, एज आई मेंशन, 9.5 साल से हम लोग रोबोटिक सर्जरी कर रहे हैं। तो 3 मेन कंपोनेंट्स होते हैं। एक पेशेंट कार्ट है, जो सबसे पहला है। वो पेशेंट के बाजू में रहता है, और उसमें कैमरा एंड अदर इंस्ट्रूमेंट पोर्ट्स होते हैं। टोटल 4 आर्म्स होते हैं ये रोबोट में, पेशेंट कार्ट में, जो हम लोग अबाउट 8 मिलीमीटर के होल बना के पेशेंट के एब्डोमेन में रखते हैं। देन दिस इज सेकंड is surgeon's console, where we sit as a surgeon and we are able to control all the instruments. लेप्रोस्कोपी अगर आप लोगों को मालूम है, तो लेप्रोस्कोपी में मरीज के पास रहना पड़ता है, somebody is holding camera, assistant holds one instrument, and surgeon holds another instrument. That's how the team is very much required. यहाँ पर हम सर्जन कंसोल पे बैठ के all 4 arms of the robot we are able to manage. Now, this is a major difference, that it gives us a stable platform. As I would mention time again and again, that our surgeries would last from 6, 8 to 10 hours, और लेप्रोस्कोपी में वो लिमिटेशंस आ जाते थे, क्योंकि फटीग हो जाता था थोड़े टाइम के बाद। वाइल वी कांट अफोर्ड टू हैव अ फटीग व्हेन वी आर टॉकिंग अबाउट कॉम्प्लेक्स सर्जरीज, तो यहाँ पर ये स्टेबल प्लेटफॉर्म होता है। जस्ट फॉर द पर्सपेक्टिव मैं आपको बताऊंगा कि पेशेंट कार्ड, हम ये सब होता है एक ही जगह पर। नावाडेज ऑफ कोर्स आप लोगों ने सुना होगा कि रिमोट सर्जरीज भी होने लगी है, एंड दैट कुड बी द फ्यूचर आल्सो, दैट रिमोट सर्जरीज होने लगेगी। हम अभी हमारे ही ऑपरेशन थिएटर में ये कंसोल रखते हैं, और हम जहां पर बैठते हैं, आई डोंट नीड टू स्क्रब। पेशेंट के पास एक नर्स होंगे, और असिस्टेंट, कभी जरूरत पड़ी तो एक असिस्टेंट सर्जन होते हैं, और मैं कंसोल पे बैठ के सर्जरी करता हूं। तीसरा कंपोनेंट है जो विजन कार्ड हम उसको बोलते हैं। तो वहां पर कंप्यूटर और बाकी के हमारे जो एक्सेसरीज होती है, वो ये विजन कार्ड में होती है। नाउ I have a small video to show the system which we are using. I call it as engineering marvel. And This is a small video. This is the vision card. I mean, the robot with four arms. This is the surgeon's console. This is from where we see inside. These are the two clutches by which I do surgeries. These are the tiny instruments. The assemblies are done. Once we have put the cannula inside that domain, the robot is brought and all the instruments are docked. So, this is the fourth generation machine that we have known as Da Vinci Xi, and what we call it as a multi-quadrant system. तो एब्डोमेन में कोई भी हिस्सों में हमें काम करना है तो अलग अलग क्वाड्रेंट में जाना है तो वी आर एबल टू गो विथ ऑल दिस रोबोटिक आर्म्स एंड इट इज सच अ फ्रेंडली इंस्ट्रूमेंट एंड दिस कंपनी हैज इवॉल्व्ड पिछले 25 साल में इवॉल्व होके काफी इवोल्यूशन होने के साथ सर्जरी रोबोटिक सर्जरी जो फर्स्ट जनरेशन मशीन था और ये एक्सआई फोर्थ जनरेशन मशीन है उसमें काफी एडवांटेजेस आए हैं एंड हम ऐसा अभी बोल सकते हैं कि वी आर नाउ एबल टू डू टोटल रोबोटिक सर्जरी। एक टाइम था जहां पर हाइब्रिड सर्जरीज होती थी, थोड़ा काम रोबोट से करते थे, थोड़ा काम लेप्रोस्कोपी से करते थे, थोड़ा काम ओपन सर्जरी से करते थे। अभी हम लोग टोटल रोबोटिक सर्जरी करते हैं। नाउ रोबोटिक सर्जरी की बात स्पेसिफिक ऑर्गन के लिए बताए तो मेनली रेक्टल कैंसर की बात करें तो जहां पर रेक्टल कैंसर होता है और हमें सर्जरी करने की जरूरत पड़ती है तो रोबोट के आर्म बहुत नीचे जा सकते हैं एंड वी आर एबल टू स्टिच टुगेदर द पार्ट्स वेरी मच डीप डाउन इनटू द पेल्विस। along with that we are able to preserve small nerves because हमें इतना अच्छा व्यू मिलता है and this leads to ultimately much fewer complications, better function and faster recovery for the patients। सो यू नो जस्ट एक नैरेट में करना चाहूंगा तो काफी बेनिफिट्स जो हम बोलेंगे तो ब्लड लॉस हैज बीन वेरी वेरी मिनिमल। हॉस्पिटल स्टे में एक पर्सपेक्टिव बताओ तो पहले हम लोग 7-8 दिन हॉस्पिटल में रखते थे मरीज को, अभी हम 3 से 4 दिन में डिस्चार्ज कर सकते हैं। तो यानी 50% रिडक्शन इन हॉस्पिटल स्टे। नाउ the important point is it is not only about कि number of days कम हुए, it is important that कि पेशेंट की रिकवरी इतनी अच्छी होती है, इतनी फास्ट होती है, तो उस हिसाब से हीलिंग फास्टर होता है तो हम हॉस्पिटल से डिस्चार्ज मरीज को कर सकते हैं। सो लेस प्ले पेन, लेस हॉस्पिटलाइजेशन and that's how they are able to go back to the family and eventually able to go back to their work faster than what it used to be before। I would say for all the parameters it is 50% reduction in all that। previously हम लोग ओपन सर्जरी के बाद मरीज 1 महीने के बाद काम पर जा सकते थे, अभी 10-15 दिन के अंदर डेफिनेटली मोस्ट ऑफ द पेशेंट्स आर एबल टू गो फॉर द वर्क। इन्फेक्शन कम हो गया है और बाकी के मेन फंक्शंस में भी काफ़ी बेटर एडवांटेजेस है। कॉस्मेटिक रिजल्ट्स, बहुत बड़ा बड़ा इंसिशंस वगैरह की जगह पर छोटे छोटे छेद बोल सकते हैं 5-7 मिलीमीटर का, तो वो करने से कॉस्मेटिक रिजल्ट्स ऑल्सो हैव बिकम मच बेटर। तो ये कोलोरेक्टल कैंसर की बात हुई। उसके बाद में स्टमक और इसोफेगस कैंसर जो हम रेगुलरली करते हैं। इसोफेगस यानी फूड पाइप, बहुत क्लियरली एक चीज है कि वो गले से शुरू होके छाती में से, थोरेक्स में से ट्रावर्स होके पेट में जाती है। इतनी बड़ी जो इसोफेगस होती है, 25 सेंटीमीटर जनरल उसकी लेंथ होती है। जब इसोफेगस की सर्जरी करनी होती है तो ये तीनों रीजियन में ऑपरेशन करना रहता है। आज से 20 साल पहले हम चीरफाड़ करते थे गले में, छाती में और पेट में। यू कैन इमेजिन कि कितने बड़े इंसिजन्स होते हैं, कितने लंबी सर्जरी रहती थी। 6 7 8 9 घंटा सर्जरी चलती थी और उसके बाद में सक्सेस रेट वाज आल्सो 50 60%। अभी ये सब हम रोबोट की पद्धति से करते हैं, तो ये बड़े चीरफाड़ नहीं होती है इन ऑल थ्री रीजियंस। एंड सक्सेस रेट हो गया है 95%। एंड वंस अगेन सेम थिंग, मरीज जल्दी से घर जा सकते हैं। सो यहाँ पर ये फायदा होता है कि डेलिकेट स्ट्रक्चर्स की हम केयर कर सकते हैं, और कैंसर का क्लियरेंस भी, बिकॉज वी हैव एक्सलेंट विजन, ये हमें काफी अच्छे से हो सकता है। इसके अलावा जीआई और कैंसर्स की बात करें तो नाउ रोबोटिक सर्जरी होती है लीवर के कैंसर में, पेनक्रियाज और गॉल ब्लैडर कैंसर में भी शुरुआत हो गई है। और दुनिया भर में ये भी कैंसर होने लग गए हैं कि रोबोट की मदद से, जैसे जैसे प्रोग्रेस हो रहा है इक्विपमेंट में, वैसे वैसे कॉम्प्लेक्स सर्जरी भी उससे होती रहती है। Challenges की बात करें, I mean there are always challenges whenever we talk about anything. One is the cost. It used to cost us 15 16 करोड़ का मशीन आता था. It has started going down, and now there are more than 5 machines available even in India, and the cost has started coming down, which is a good news for the patient. And second is the training for surgeons. Availability in पूरे इंडिया में अभी अबाउट 170 इंस्टॉलेशन है इसके, और बाकी और मिला के आई वुड से अबाउट 250 इंस्टॉलेशन है। वाइल माय रफ गैस वुड बी कि 10,000 रोबोट की जरूरत है। तो ये बहुत कम है, अभी शुरुआत है। और इसमें सर्जन्स की ट्रेनिंग इज ऑल्सो ए चैलेंज, क्योंकि जितने सर्जन्स ज्यादा ट्रेन होंगे इतने वो सर्जरी कर पाएंगे। इसके लिए बहुत एफर्ट्स हो रहे हैं। जो भी ट्रेंड सर्जन्स है ट्रैवल करके इंस्टीट्यूट में जाके, कॉलेजेस में जाके स्टूडेंट्स को पढ़ाते हैं। If we talk about our center, we have now completed more than 2,500 surgeries. And in my GI department, I have done 585 surgery, and my other colleagues have done about 400 more surgeries. So we are now close to 1,000 surgeries for GI cancers. Uh, so ultimately, if I have to talk about today's title, Hope, Healing, and the Future, this robot brings precision, safety, and faster healing, which definitely results into a better outcome for the patient and smile on the patient face. And we are really very happy. We are really very, very fortunate with this era in which we are living. And I look into the future with lot of optimism that robotic surgeries are going to grow. Ultimately, it is going to make the life of patient much, much better. I think I would like to close my presentation at this stage, and would be happy to answer any questions that one may have. Thank you so much.
Doctor, what are the limitations of robotic surgery? Do they have?
Yeah, so I would repeat what I showed once again, that one is the cost, which is prohibitively expensive. And trained people, the, there are very few robotic installations in the medical colleges. And whenever we interact with the companies, we always say that, that your focus area should be medical colleges, where there are surgeons are undergoing training, and you need to train them. And so that is on one side. On the other side, wherever I go and talk to the uh, surgical fellows, trainee, I tell them that you guys have no choice. You'll have to adopt robotic surgeries because it is going to stay here and it is going to get better and better. So these are the two major limitations, so to say, at this stage for robotic surgeries.
What about the touch and feel?
Yeah. So, this is what we were struggling in the initial time. And in our terminology, it is known as haptic feedback. That, the touch and that feedback that you get is known as haptic feedback. And this is completely absurd because this is surgery which is the movements are transferred by the computer onto the patient. So there is absolutely no feedback. So this has to be replaced by your visual acuity. And this is, one of the challenge that I would say that cognitive challenge is there when you are not having that haptic feedback. But believe me, the way we are getting that vision, the way we have control over our instruments, I think we generally are, I mean, we don't really feel that this is what is lacking. Now, recently only, the next generation of the machine, which is known as DV5, there they have started experimenting with some instruments wherein you get some amount of feedback that is known as force feedback. And you have that when you put that force feedback mode on, and when you pull onto the tissue, you have that feeling that how much you are pulling. So that is how it has started, and that is also going to be useful. Their idea is that at a different period of time, doctor may be applying sometime excessive force onto delicate organs. So their idea is to reduce, to minimize the injury to or force to a given organ. So very valid question.
Thank you, sir. Friends, whoever else joined later on, I must mention promote mentioning like I am having acquaintance with Dr. Kotari for more than 10,000 days, or I would say 28 years. And here today, you can see him. I mean, he has just come out from operation theater, and today is our 40th session at Friday's with Shrenik. And number two, we keep on bringing it innovative subject, innovative expertise, for sharing their knowledge, experience, and expertise. Now, sir, we have very profoundly explained everything about robotic surgery. Now, I mean, nowadays on our social media and various platforms, people are talking a lot about AI, that is artificial intelligence. I would like you to give us some background, some information, knowledge uh, while performing the robotic surgery and utilizing AI. So, I mean, please correct me if I am wrong, but I still believe that human intelligence, that is HI is 10 times bigger and bigger than AI. And I don't think that, AI can ever replace the human intelligence. Can they guide us?
Yeah, so Shrenik Bhai, as you rightly said, no talk today is complete without talking about AI. So very pertinent. And honestly speaking, I am excited and passionate about doing surgery and adopting any new technology that comes. I'm excited even for the AI as well. And so what we feel is So just once again to give one more perspective about what I spoke about the DV5, the fifth generation machine that they have the machine which is fourth generation, and in fifth generation they have 10,000 times more computing power in a new machine. 10,000 times more computing power. Now, when this company which has thought about it and has given this kind of a power, and we have a lot of interactions, I have been to their uh, R&D departments also and have interactions. So the whole idea is how you can make this surgery more safe. That is where it is going to be invested maximum. Now, excuse me, just to give a simple perspective, we are looking at a, a now, a very, very important now when I am doing one surgery, which has ultimately functioned for our urinary control. What is the expected AI going to do is with mapping of all the surgeries. Now, more than 1 crore surgeries are performed on the robot. Uh, they are having this kind of data, and this AI is expected to make a path of this nerve. And whenever I am doing surgery, now every surgery is not simple. We have complex cases. We have cases where we get in second time, third time also, and every time it becomes more and more complicated surgery. Now, if at that point of time, if I'm given a guidance with the help of AI that the path in which I am doing surgery, the nerve is coming very close to this area. Or if I am trying to cut particular area, AI is going to stop me. Doctor, this is a nerve. Do you really want to cut it? It's going to ask me. Sometime I have to cut it. If it is involved by cancer, I have to cut it, but it is going to guide me. So this is one of the applications which we are talking about that AI is going to bring. Second thing which is going to happen is that even in our surgeries, some of the steps, I would say they are mundane steps, not extremely important steps. So in future, there could be a time where these mundane steps would be kind of autonomous. So that can also happen. The third thing is the challenge in teaching and learning. Here also, with the distance, this capability is going to make it better. There are now simulators available on this robotic system. So the people in training, they'll be able to simulate it better. Better and better simulation will happen with the help of all this information. So that's where I am excited.
Thank you. But sir, I still want to ask the same question. Once again, do you think, do you think that AI can replace human intelligence?
It is impossible, Shrenik Bhai. Who is making AI? It's
Humans.
great human minds are making it. And who is constantly developing? It is great human minds only. There is absolutely. So AI is ultimately, my assistant. It's not my boss, and I'll be able to utilize the way I want it. So, I mean, some mundane things I do not want, I should do it. So those things will be taken care of by AI so that I spare myself for better and better, more intelligent work. And that's how it is going to be useful. Absolutely.
Thank you, thank you. Yeah, let's open the floor for rest of the people, and you can ask as well.
Dr. Kothari's conversation is very interesting and it is stimulating all of us to ask him questions. Dr. Kothari, since we are from a non-profit organization, so one question which will come across besides survivorship, of course, is cost, access, and equity.
Yeah. Um, so, I think We are talking about robotic surgery, right? In the
Right.
perspective.
Yes. Yeah.
So this is definitely a cost prohibitive at this stage, but thankfully so that what it used to be before 5 years and now, the cost has not only not increased, it has started going down for sure. So the cost is definitely coming down. And as I mentioned before, is a couple of times that the hospital stay has become at least 50% of what it used to be. So you are saving costs there as well. So these are incremental benefits which are happening, and that's how the cost is definitely going down. And I think we'll have to wait for this, that it becomes really the word we can utilize is democratize the robotic surgery for the general population. We will have to wait for some time, you know.
But would it be covered under insurance? Is it covered under insurance?
Yeah, so with lot of representations from everybody and more so by the patient's feedback, uh, I would probably now believe that all insurance companies are now covering. And the sponsored programs by the corporates, or say for example ONGCs and गवर्नमेंट स्पॉन्सर्ड हॉस्पिटल्स और जो भी कुछ CGHS ECHS वो हम
Yeah.
लोग जो बोलते हैं, तो वहां पर भी कवर होना शुरू हो गया है.
Ayushman Bharat?
Ayushman Bharat, not in a private hospital,
Mhm.
but in government hospitals where the robotic installations have started, that's where also it is, case to case basis, it has started being approved.
Yeah. And that last
Sir,
question I had asked you, doctor, about the survivorship roadmap and that fear of recurrence, and also with robotic surgery, has it reduced? Or because you did mention that as an when the cancer reoccurs, it becomes a little more complicated for you all to do the surgeries. So
Yeah.
how is that addressed?
So, this is always a very important point close to my heart, that the conversation that happens in our outpatient department, with the patient and the patient relatives. Now, we would engage depending upon how the conversation goes on. As all of us know that still 20-30% of the patients, even today, the relatives will come and tell that patient doesn't know and please don't share that with them. So we have to start educating them first, that please do not do that, this harms your near and dear ones. It is important that they should know what they are suffering from, and all of us have to help them how to cope up with this. Only then their outcome is better. There is absolutely no doubt about it. So we have to educate them now. uh, Going beyond that, those who are ready to engage into it, uh, when we talk about surgery and talk about robotic surgeries, uh, they definitely have now confidence that the pain, the main idea of pain is much less, because the size of the incision. I would of course talk about only my specialty, that I have to open up the whole abdomen and do surgeries, and instead of that there are only holes, just to say that perspective. That anxiety definitely reduces. The moment I say, and I think I tell to every patient कि आप में बड़ी चीरफाड़ नहीं होगी, and we will be doing surgeries with few millimeters holes. And now the time has come that in our country also, we have been doing for 9.5 years, and in our country it started about 15 years back. Initially it was a slow progress, but now many patients, they would come to us with the idea that, doctor, I want a robotic surgery to be done on me. So that way it has definitely gotten better. And we at every stage, what you were trying to ask, every stage we try and educate the patient and relative that please engage yourself with complete transparency, then we will be able to guide you better. We tell them that anxiety will be reduced if the patient knows what they are suffering from and what kind of treatment is to be done. With their knowledge, the outcome is always better. So we try and do that as much as possible. I hope I have answered your question, but if something else still missing, you please ask.
Sure.
Sir, and I think with everything you say and Dr. Priya mentioned, say I rather see a very important point here. I mean, performing the robotic surgery as against conventional surgery. There are two. I mean, apart from financial aspect, the survivor ratio for others, success ratio is far more higher than conventional surgery. So, at the end of the day, apart from financial expenses, people and their relatives, they always look at a survivorship much more than, spending X, Y, Z amount. So that is rather one of the clear advantage for opting robotic surgery and at the same time the healing time reduces, the pain problem gets reduces, and even recurrent issues and side effects, etc. That can be reduced to a larger extent. This is what I understand from your conversation.
So I can elaborate a little bit more here, how the survival is different, or sometime I would say that better, as Shrenik Bhai also mentioned, that we have, say for example, people have started living longer now, and we have patients with some complexity, some medical problems or other problems. While doing robotic surgeries, the post-operative recovery is faster. Even the patient has got heart problem or a lung problem or diabetes, the recovery is faster, less complicated. That is how one treatment is done, surgery. Now, as you know, in our country and in many of the cancers, patient require more than one modality of the treatment, say radiation or chemotherapy or both. Surgery done by robotic surgery, minimally invasive surgery, because of the faster recovery, we are able to start radiation and chemotherapy earlier than what we used to do it before. And if we are able to start this in time, the outcome is overall definitely better than what it used to be in past.
Absolutely. And at the same time, relatives or caregivers, they can also live their life at much more ease. उनको ऐसा नहीं लगता है कि बस हमारे इनका जाने का टाइम आ गया. So that is one of the biggest ever comfort level one can have as a caregiver or whoever is supporting the cancer patient and survivors. Sir, one more question. Uh, post robotic surgery, what are the chances of a recurrent cancer?
So, Shrenik bhai, it would be, I would say that, the chances of recurrence would vary depending upon the stage of the disease, and if patient comes to us in a advanced stage, nowadays, we don't directly jump onto the surgery. Sometimes we give chemotherapy or radiotherapy first and then do surgery. That is how the chances of recurrences are reduced. But earlier the stage, chances of long-term cure, and we emphasize more is the organ preservation, that you don't have to sacrifice the whole organ or the part of the organ, if it is diagnosed and treated early.
Sir, one more question. I mean, not for me, but for other listeners, you usually while performing or while taking any specific decision, whether it is radiotherapy, chemo, or surgery. You are having a kind of a team. I mean, where you all are taking collective decision, not one man decision, but collective decision. Can they guide us on that aspect as well? Of course, I am aware, but this is what you guys are doing on a weekly basis.
Yeah, so very important point, Shrenik, by uh, what is known as MDTs, multidisciplinary team. And nowadays, world over, wherever there are comprehensive cancer centers, this is the practice, what we call it as tumor board or multidisciplinary team, wherein our fellows or students will make a presentation of the cases, and all the experts, surgeon, medical oncologist, radiation oncologist, radiologist, pathologist, physiotherapist, nutritionist, gastroenterologist, all would be together and we discuss and then uh, find out the best option for the management of this patient. And this is now even scientifically proved that the patient outcome, when we talk about the survival, the patient survival is better when they are treated in this kind of MDTs. There is absolutely no doubt about it. Because as professionals, sometimes we would be guided, we would be carried away by one particular information, while we might have missed a small information while it is brought into the notice during this kind of a discussion, and you realize that yes, this is the best way that we need to deal this, and that's how the outcome improves.
Sir, I believe that there are the magic there are the magic of conducting such webinars where children public can learn, get idea, thoughts, and we are very profoundly explain how robotic surgery is being done. Say, I mean, importantly, when somebody is asking about or thinking about robotic surgery, मतलब before robotic surgery में जाने के पहले ही शायद मर जाएगा सोच के. So this is commendable knowledge and everything you have shared with us, Priya. आगे आपको.
I have one last question, which is a very layman type of a query, Dr. Kothari. Um, when the doctors are trained for robotic surgery, is it some virtual simulators or something where they first sit like a video game and sit and practice over there before they start going on to? So is it an element of gaming is there in surgery?
uh, I don't know whether we would call it as gaming, but there is a structured program
Mhm.
wherein you need to do some exercise sitting on the console. And once you do complete that exercise, your step one is done. Thereafter, there is a step two wherein you go to the center and you would do some procedures on either on a pig model or some other model. A human model also is available, and you do certain steps. So that also is a 2-day program. That is number two. And then better and better simulations are now available so that you can simulate the procedure which you are going to do tomorrow. And you can do that exercise today. That's how it is now progressing. So it definitely requires that kind of rigorous training, rigorous mentorship, and hand holding. I would say everything is required to really do this successfully. And fortunately for us, the generation in which we have acquired a robot which is fourth generation, where it has become really a very good enabler, and we have been able to, for us, honestly speaking, the learning curve was not as steep as what it used to be with probably generation one or
Earlier.
generation two machine.
Mhm. So how much time does it take for a surgeon to be trained on this machine and then going out and operating?
Yeah. So, I would say that at various intervals, about month or two before they can really would be prepared or ready with whatever fear that they have. Obviously, when they are sitting for the first time, they would require that kind of couple of months of this, and then uh, to independently doing surgeries. Of course, that background is also important, that surgeon has otherwise how much experience. Say, for example, if I talk about me, I had experience of doing surgeries for 20 years when I started my robotic surgeries. So it depends that as well. But we call it as how quickly you are able to do your first 20 cases, your first 50 cases, and then depending upon the complexity, it would be said that now you are proficient in these particular surgeries. Our surgical time, honestly speaking, I mean, I have to admit that suppose if my first 5 cases, I would have taken 8 hours in completing that surgeries. Nowadays, we never exceed more than 4 hours in these surgeries, and sometimes we would do it in 3 hours. So this is how, the benefit that also accrues over a period of time.
So, is it fair for a patient to ask their doctor, okay, sir, how many hours have you had? If the surgeon, because sometimes patients are hesitant in asking their doctor, okay, sir, with that little fear, I know in the background, कि कोई instrument slip na ho jaye, since it's a machine that you're holding, because as a lay person, they don't have an idea. So, would it be fair for them to ask, okay, sir, how many hours of experience have you got under your belt while you're undertaking this?
So, the first part of the question, which is very important, and I would say, and honestly, I believe in that, it is fair for patient to ask any question to the doctor. You know, no matter how silly it looks like, they have to ask. I tell very simple thing. If something comes in your mind, please ask. Don't go out of my office before asking, keeping it in your head, because ultimately that can come in your way of recovery. So this is very important first part of this. The second part, we were asked these questions. Doctor, how many robotic surgeries you have done? In my first year, in my second year, they used to ask me, have you really done these surgeries? We had different answer then, that I have this experience and this is how I have been doing, and I know what are your case, I can do it. I don't do it in all cases. Honestly, I don't remember in last 3 4 years anybody has asked me whether you have done and how many surgeries you have done. They know probably, or I don't know, you know.
Because they come with a very trivial question to us sometimes. कि
Absolutely.
रोबोट है, मशीन है, कुछ अगर गिर गया, मेरे को छेद और हो गया.
Yeah.
You know,
So very true. And actually speaking, we call it as probably as a fashion that we do talk about. It's a robotic surgery, but the true meaning is robotic assisted surgery.
surgery.
So we elaborate on that also, that robot does not do any step of surgery. It's all steps are initiated by me. 100% surgery is done by me only.
Yeah.
So because once in a while, patients would come and they might have, fear, because the awareness is not there. Still, the
Yeah.
awareness is not that much great. So some of the relatives, some of the doctors, those who do not have experience or have ill experience of something, the patient would come and tell us that, doctor, it's very simple. I want open surgery only because I believe that your hands are like a robot. This is how the conversation happens.
Yeah.
Now, of course, that used to happen more in past. Now they are honestly are ready to undergo surgery the way we explain to them.
Because
Friends,
awareness literature is very important. These are very basic questions, but which patients get. And there is always that white coat syndrome where they are a little scared of asking, but
Of
they
course.
scurry back and come and ask us.
Yeah,
So,
yeah,
that type of awareness literature and all, if it is available, it
yeah,
would make a lot of difference.
absolutely, absolutely.
Uh, Friends, HCG Cancer Care that is in Ahmedabad is my second home. That's number one. And today I have seen Dr. Kotari in altogether different mode. You know, I mean, I am knowing for more than 28 years. So, he's right, he's so spoken. And you know what? When you are thinking that, he's going to speak 10 sentences or 20 sentences, he will speak with only 5 sentences, then he's done. And today he has spoken everything so profoundly, so eloquently. So salute, and believe me, I am definitely blessed by Lord Krishna having met you before 30 years. Thank
Thank,
you so much. I really have no words to express my gratitude.
thank you, Shrenik Bhai.
And thank you so much for answering all our little queries so patiently. It's
Anytime.
been a pleasure interacting with you because we wanted to speak a lot more.
Absolutely.
And thank you so much.
Priya, one more point I would like to add. Uh, last I think last year on their wedding anniversary, Dr. Kalpana Kothari was to come to our ICS delivering talk, and Dr. Kalpana Kothari asked Dr. Jagdish why today is our wedding anniversary, should I go? So, Dr. Kothari was so kind that he said when Shrenik Bhai has invited you, you must go. You don't have a choice. So this is, he's so generous, believe me. I don't know what's,
And
so
Dr.
thank you.
Kalpana is also a very fabulous speaker.
Yes.
Spoke so well. She enamored all of us over here
Okay.
that now she's like a go-to type of a doctor that let's get Dr. Kalpana on board.
Absolutely.
I mean, it's
So,
lovely to see the human angle of doctors also, no? When they're sitting and addressing these queries. It makes one feel very connected.
sure. Thank you. I will tell Kalpana today itself that, you are still remembered.
Very well remembered.
Sure.
Sir, thank you once again for your valuable time, and let's meet up for a coffee sometime. Thank you.
Sure. It was a pleasure talking to all of you. All right.
Bye bye, sir. Bye.
Bye, sir. Bye.
Bye.
Thank you.